The most common question I get is if obesity really is a disease. This episode will help address this question and also the stigma that is related to it. If there's one message that I want to share everyone through my work, it is that your weight is not your fault. I want to address the bias related to being overweight and educate everyone about the root cause of obesity. This information might be too detailed, and it is okay if you don't fully understand all the medical terminology. But I'll try my best to make it as digestible as possible. The main focus of the next few episodes is to discuss the pathophysiology in detail for everyone to learn how complicated weight regulation is. Obesity has traditionally been misunderstood as purely a matter of willpower or personal choice. Everybody can understand this. People who are overweight have been judged all their life for their weight. While lifestyle factors like diet and physical activity play a role, the disease process is far more complicated. Scientific research has shown that obesity is a complex multifactorial disease which is deeply rooted in genetics, epigenetics, disruption in neurohormonal pathways, environmental factors, and socioeconomic conditions. Obesity is not just individual behavior. It is a disease that continues to challenge our understanding. It was first recognized as a disease in the International Classification of Diseases by WHO in 1948, marking the first formal recognition of obesity as a disease. WHO declared it as a major public health problem and a global epidemic in 1997 due to increasing prevalence and associated health risks. However, it was not officially declared as a disease by American Medical Association until 2013. This was only 12 years ago. AMA emphasized the complex chronic nature of obesity and the need for comprehensive medical interventions. The decision was driven by the understanding of the disease and its significant health consequences. While research has advanced significantly, there is still so much to uncover. Given these influences, labeling obesity as simply a volitional problem overlooks the biological and systemic factors at play. Effective treatment requires a medical, behavioral, and societal approach, and hence a multidisciplinary team. As science continues to evolve, so does the approach to prevent and treat, moving towards personalized, evidence-based strategies. Now we know that it requires collaboration with physicians, nutritionists, behavioral education retraining by clinical psychologists, coaches, exercise physiologists, addressing the mental health by treating underlying mental health conditions, and bariatric surgeons whenever appropriate. I'm hopeful that with all the organizations advocating for obesity management and healthcare professionals working at the grassroots can continue to advocate and educate for individuals living with obesity.